Your kidneys are being poisoned right now. Not by a drug and not by anything your doctor warned you about. It's sitting in your kitchen at this very moment. Something you likely ate this morning thinking it was perfectly safe. Today, I'm exposing the 5 worst things you can do to your kidneys. We're ranking them from serious to the one single habit that is destroying more kidneys in America than every other cause on this list combined. Number 1 on this list is currently destroying more kidneys than every other poison combined. And chances are you consumed it before 9 o'clock this morning. Identifying these 5 triggers is the literal difference between keeping your independence or facing a decade of steady renal decline. For my patients, the goal isn't just a better lab result. It's staying out of a hospital bed and keeping the freedom to live life on your own terms. No jargon, no fluff, just the clinical reality your doctor never shared. Once you cross 60, your kidneys operate with a much smaller margin of error. Think of them like the brakes on a car with 200,000 miles. They still work, but they don't respond like they used to. The 5 things I'm naming today hit that system harder now than they ever did at 45. Poison number 5, chronic dehydration. After 60, your body quietly stops telling you when you're running low on fluid. The thirst mechanism weakens with age. Research confirms it. Older adults can be clinically dehydrated and feel nothing. No urge, no warning, just a daily deficit. Your kidneys are absorbing silently alone. Here's what that deficit does. Your kidneys need strong, consistent blood flow to filter waste. When fluid drops, even mildly, blood flow to the kidneys constricts. Waste products that should be flushed out begin concentrating inside kidney tissue itself. Creatinine builds, uric acid builds. And repeated exposure to that concentrated environment damages the microscopic tubules, the fine internal channels responsible for the final stage of filtration, day after day without a single symptom. Now, if you're thinking, I drink coffee every morning, I can't be dehydrated, coffee is a diuretic. It pulls fluid out. It's that simple. Tea, alcohol, high sodium food, all of them deepen your deficit rather than solve it. The only thing that counts toward real hydration is plain water. And after 60, drinking by thirst alone is no longer a strategy. That signal can no longer be trusted. Here is a self-check you can do right now without any equipment. Look at the color of your urine the next time you use the bathroom. Pale yellow, almost clear, means you are adequately hydrated. Dark yellow, amber, or anything approaching orange means your kidneys are currently filtering at low volume. Most older adults who see that color assume it's normal. It is common. It is not normal. That color is your kidney tissue telling you it is working under strain. The fix is specific. 2 full glasses of plain water first thing every morning. Before coffee, before food, before anything else. This single habit replenishes the overnight deficit and starts your kidneys' first filtration cycle with the volume they need. Set a phone reminder at lunch and again mid-afternoon for 1 more glass each time. You are not waiting to feel thirsty. You are running a schedule. That is the entire strategy. And it costs nothing. Poison number 4. Most people I talk to believe they've already handled the sodium problem. They put the shaker away, they cook at home, and they're genuinely proud of that. But here's what they don't know. The salt shaker was never the main source. Not even close. More than 70% of the sodium in the American diet comes preloaded inside packaged food, already in there before you open it. It's in the bread, the canned soup, the deli meat, the frozen meals, the breakfast cereal, the bottled salad dressing, the cheese. It frequently doesn't even taste salty. A single can of soup can carry over 800 milligrams of sodium. 2 slices of deli turkey, 600. A tablespoon of soy sauce, nearly 900. Most people eating what they believe is a reasonable diet are running at 3,500 to 4,000 milligrams a day. The kidney protective ceiling is 2,300. There is also a label trap I need to warn you about specifically. Products marked low sodium or reduced sodium are not necessarily safe. They are simply lower than the original version of that product. A reduced sodium soup may still contain 500 milligrams per serving. That label is a comparison to itself, not a recommendation for your kidneys. Always go to the actual milligram number on the nutrition panel. The marketing on the front of the package is written by the sales team. The number on the back is the truth. Why does this matter for your kidneys specifically? When sodium floods your system, your body retains water to dilute it. That retained water increases the total volume of blood in your arteries. Higher volume means higher pressure, and that pressure runs directly through the tiny, fragile capillaries inside your kidney filters, structures so delicate that sustained pressure physically damages them. The National Kidney Foundation identifies high blood pressure as the second leading cause of kidney failure in the United States. Hidden dietary sodium is one of its most consistent drivers. The fix takes 2 minutes at the grocery store. Flip every package over before it goes in your cart. Find the sodium line. If a single serving contains more than 600 milligrams, that product is worth reconsidering. Identify your 3 highest sodium regular purchases and swap them. And for canned vegetables, rinse them under running water before cooking. That one step removes up to 40% of the added sodium. Specific swaps your kidneys register within weeks. Poison number 3, and this is the one I find hardest to talk about. It involves something millions of older Americans rely on for real daily pain, and I want to be straight with you about that. Arthritis is real. Back pain that has been there for years is real. I am not here to dismiss any of that. But what is also real is the mechanism, and most people have only ever read the warning label. They've never been shown the biology. So let me show you. Daily NSAID use, ibuprofen, naproxen, diclofenac. Sold over the counter, trusted by millions, and for occasional use, a reasonable tool. But daily use in adults over 60 is a direct documented threat to kidney function. And the damage doesn't begin after years. It begins within the first month. Your kidneys maintain blood flow through their filters using compounds called prostaglandins. Think of them as pressure regulators, keeping the blood vessels feeding your kidney tissue open and working. NSAIDs work by blocking the enzyme that produces prostaglandins throughout your entire body. That is how they kill pain. But they do not distinguish between the prostaglandins inflaming your knee and the prostaglandins protecting your kidneys. Both get blocked. Blood flow to the kidney filters drops, oxygen delivery drops, and the filters begin sustaining damage that, repeated daily, becomes permanent scarring. A large study published in the BMJ found that regular NSAID use was associated with a 20 to 50% increased risk of accelerated kidney decline, starting in the first month. There is a second layer to this that affects older adults specifically. Many people over 60 are managing more than one condition and taking more than one medication. NSAIDs interact badly with several of the most commonly prescribed drugs in this age group. ACE inhibitors, diuretics, blood pressure medications among them. That combination can accelerate kidney damage far beyond what either drug does alone. If you are on any prescription medication for your heart, blood pressure, or fluid retention, and you are also taking daily over-the-counter NSAIDs, your doctor needs to know. Those two things together are not a safe combination without active monitoring. So what do you do with real ongoing pain? 3 things. First, acetaminophen works through a completely different mechanism. It does not block the prostaglandins protecting your kidneys. For musculoskeletal pain, it is frequently equally effective. Second, topical diclofenac gel applied directly to the joint delivers anti-inflammatory relief locally without the systemic effect that damages kidneys. Ask your pharmacist specifically for it. Third, if you are currently taking daily oral NSAIDs, ask your doctor to check 2 specific numbers, your creatinine and your eGFR. These tell you exactly where your kidney function stands right now. Many people on daily NSAIDs have never had those numbers checked since starting. That conversation is overdue. 3 down, 2 to go. These next 2 are the ones I see doing the most damage in patients who had absolutely no idea they were even at risk. Poison number 2. Take any packaged food you've eaten in the last 24 hours. Turn it over. Find the ingredient list. The long paragraph most people skip entirely. On the majority of ultra-processed foods sold in this country, somewhere inside that list is a category of additive doing something specific and almost entirely unknown to your kidney filters. It hides under names that sound technical and harmless: disodium phosphate, calcium phosphate, phosphoric acid, sodium hexametaphosphate. The food industry uses these to improve texture, extend shelf life, and intensify flavor. They are in baked goods, deli meats, frozen meals, cola beverages, fast food, processed cheese slices, instant noodles, and packaged coffee creamers. Products you bought this very week. For your kitchen, your kidneys are responsible for filtering excess phosphorus from your blood. When you eat whole foods, fish, chicken, beans, the phosphorus is bound to organic compounds your body absorbs at around 40 to 60%. manageable. But the phosphorus in synthetic phosphate additives is absorbed at over 90%. It floods the bloodstream. In a kidney already operating at reduced capacity, that flood cannot be fully cleared. Phosphorus accumulates in the blood. The body responds by pulling calcium from bones to try to rebalance it, which is why chronic kidney disease and bone loss so often appear together. And inside kidney tissue, the sustained phosphate overload triggers internal scarring, the fibrosis that marks the final stage of kidney disease progression. The identification step is simple. Scan any ingredient list for the letters PHOS. Any product with multiple phosphate additives is a product your kidneys are quietly paying a price for. Replace it with a whole food equivalent, where the phosphorus is bound, absorbed slowly, and manageable. That one habit? Scanning for PHOS before you buy takes 3 seconds, and it changes what enters your bloodstream at every single meal. And now we are at number 1, the worst kidney poison in the American diet. The one I saved for last, not for drama, but because this one does not attack from one direction. It runs 4 simultaneous lines of attack on your kidneys, all of them silent, all of them pointing toward the same destination. The identification step is simple, but only if it becomes automatic. Every time you pick something up, turn it over, not sometimes, every time. Ignore the front, that's marketing, the back is reality. Scan for one pattern, PHOS. It won't appear clean. You'll see calcium phosphate, sodium phosphate, phosphoric acid, different names, same intent. These are engineered additives built for shelf life, texture, consistency. And when you see more than one, that's not sluchai, that's formulation, optimized for performance, not your physiology. Once inside your body, these compounds behave differently. They are unbound, rapidly absorbed, moving fast into your bloodstream, no gradual release, no buffering, just load all at once. Your kidneys respond immediately, they filter, regulate, compensate in real time, but this isn't one exposure, it repeats meal after meal, day after day. And that's where the strain builds quietly, progressively. No alarm, no signal, no moment that tells you something is wrong, just accumulation beneath awareness. So the adjustment is precise, not extreme, not overwhelming. You don't remove everything, you replace selectively. When a product carries multiple phosphate additives, you switch to the whole food equivalent. Because in whole foods, phosphorus is bound, absorbed slowly, controlled, manageable. Same type of meal, different internal effect. And the habit stays small, 3 seconds. Scan for PHOS before you buy. That one action becomes a filter, so shaping what enters your bloodstream every single time. Because nothing you eat is neutral, every ingredient is a signal, every choice is direction. And now we arrive at number 1, the worst kidney poison in the modern diet, not saved for drama, but because it operates differently. This one doesn't attack from one direction. It runs 4 simultaneous lines, all silent, all compounding. Different pathways, converging, same destination. Added sugar, and its identical twin, refined carbohydrates. White bread, white rice, crackers, sweetened cereal, flavored yogurt, fruit juice. Not occasional indulgences, but daily defaults repeated across meals, snacks, and routines without pause or awareness. They feel familiar, convenient, harmless, but that familiarity hides speed. These foods are stripped of fiber and structure, so digestion is immediate. They convert into glucose rapidly. No delay, no buffering, just a sharp rise directly into the bloodstream. And one spike alone is not the issue. It is repetition. Morning, afternoon, evening, day after day, year after year. That repeated glucose load becomes the primary driver behind type 2 diabetes, now the leading cause of kidney failure in this country. Not a single event of damage, but a sustained metabolic environment. Front 1, the diabetes destruction pathway. Each rise in glucose triggers insulin release from the pancreas, a signal instructing cells to absorb sugar and restore balance. Early on, this system is precise, efficient, controlled, but biology adapts to pressure. With constant exposure, cells begin to respond less effectively to insulin. This is insulin resistance, and gradual at first, then increasingly pronounced. The body compensates by producing more insulin, higher levels, stronger signaling, attempting to force glucose into cells that are no longer responding normally. For a time, this maintains control, but over time, compensation itself becomes insufficient. Glucose remains elevated longer than it should, not only after meals, but between them. The baseline shifts upward, and sustained elevation changes chemistry at the molecular level. Glycation begins. Excess glucose binds directly to proteins, forming advanced glycation end products. Inside the kidneys, this becomes critical. Filtration structures depend on thin, flexible membranes, precision-built at microscopic scale. Glycation stiffens these proteins, thickens the filters, reduces elasticity and selectivity. As structure changes, function declines. Waste clearance becomes less efficient. Pressure inside filtering units increases. Subtle strain builds with every repeated exposure. And because this process produces no immediate symptoms, no pain, no warning signal, it continues unchecked. Each cycle adds to the last. Each spike compounds the previous one. Over time, what was once temporary metabolic stress becomes persistent structural damage, accumulating silently within the kidney filtration system. This is not a slow, vague decline. Under a microscope, glycated kidney tissue looks caramelized, literally hardened and distorted by years of sugar exposure. This process, diabetic nephropathy, is the fastest route to dialysis that exists, and it begins years before any diabetes diagnosis appears on a blood test. Front 2, blood pressure through the back door. A high sugar diet raises blood pressure through a mechanism completely separate from sodium. Fructose, the component in table sugar and high fructose corn syrup, directly drives uric acid production, which triggers your kidney's own internal pressure system, independent of salt intake. This means controlling sodium while ignoring sugar is only half a defense. Both pathways are running simultaneously. Both need to be addressed. Front 3, inflammation that scars from within. Added sugar drives chronic low-grade inflammation by producing compounds called advanced glycation end products, AGEs, that accumulate specifically in kidney tissue, trigger immune responses, and promote internal fibrosis. Front 4, and this is the one that earns the anger. The foods doing the most damage are the ones marketed as safe choices. Low-fat yogurt with fruit on the bottom, 26 grams of added sugar. A serving of popular granola, 18 grams. A glass of orange juice, 24 grams. A protein bar marketed as a health food, often 20 to 25 grams. An older adult eating what they've been told is a healthy breakfast can consume 80 grams of added sugar before 9 a.m. Here's what you do, in order of impact. First, eliminate liquid sugar entirely. Sodas, fruit juice, sweetened coffee drinks. These deliver glucose directly into your bloodstream with no fiber, no slowdown of any kind. Replacing them with plain water or unsweetened tea is the single highest impact dietary change available to you for kidney protection. Second, find the added sugars line on every nutrition label. Not total sugars, added sugars. Any product showing more than 10 grams per serving deserves a replacement. Third, swap refined carbohydrates for intact whole grains. Oats, barley, lentils, where the fiber slows glucose absorption by 40 to 60%. Not elimination, just replacement. Treat low-fat products as a warning sign, not a health signal. 5 poisons, all of them ordinary. All of them operating inside the daily routines of millions of older Americans, without a single symptom to mark the damage they are doing. But here is what I want you to hold on to when this video ends. Every item on that list is a decision. Not one catastrophic decision, but dozens of small ones made possible only because someone finally explained what was actually happening inside your body. You decide whether to drink water before the coffee. You decide whether to flip the package over in the store. You decide whether to pick up the phone and ask your doctor about those daily NSAIDs. You decide whether to scan for POS before it goes in your cart. None of these require a perfect day. None of them require a dramatic life overhaul. One better choice today compounds into a different trajectory 6 months from now. The people in your life who need this information are not going to find it on their own. They don't know the specific question to ask. Send this video to someone you care about. Your spouse, your sibling, your neighbor. This information only saves people if it reaches them in time. Subscribe and turn on notifications if you want to keep receiving research-backed health information delivered this directly. I'm Dr. Michael Kent. Your kidneys work for you every second of every day. Start working for them.